Hello and welcome to Med4Care. Today's topic is pollakiuria. Let's find out together what it is. Pollakiuria is a little-known name for a rather common ailment. Do you have any idea what we are talking about? Simple! The term pollakiuria comes from ancient Greek and indicates the need to urinate very often. Determining when peeing too often becomes problematic is complicated because there is no absolute value of normality. However, there is a limit to variability beyond which we can speak of pathology. But what are the causes of this disorder? Among the most frequent are urinary infections, such as cystitis, which lead to frequent urination and in small volumes. This may also be associated with other symptoms such as difficulty urinating, pain during urination, and spasmodic contraction of the bladder muscles. Another possible cause is urinary stones. The presence of stones, especially in the case of gravel or microcalculus, continuously irritates the excretory tract and causes inflammation. The presence of masses in the abdomen can also be the cause of pollakiuria. This is the case, for example, of benign prostatic hypertrophy in men or uterine fibroids and ovarian masses in women. In particular, for women, hormonal conditions can also significantly affect the frequency of urination. For example, pregnancy as well as menopause lead to a more frequent urge to urinate. Endocrine problems such as diabetes also increase the number of urinations. This happens both because diabetes itself causes pollakiuria and for the neurological disorders that can derive from it. In fact, neurological problems such as spinal cord injuries and psychic pathologies such as anxiety and depression can also be associated with pollakiuria. The diagnosis of pollakiuria is therefore complex and often requires special precautions on the part of the doctor. Indeed, often during the anamnesis it is useful to ask the patient to keep avoiding diary to avoid subjective overestimations. The doctor asks the patient if there are also any symptoms associated with the problem. This identifies the likelihood of a urinary infection or obstructive or hormonal urination disorders. For example, worrying symptoms could be fever, rapid heartbeat, or flank pain, as they are often associated with pyelonephritis, a bacterial infection affecting one or both kidneys. During the physical examination, doctors conduct targeted inspections based on the patient's gender. In men, he will inspect the testicles and epididymis and ascertain the state of health of the prostate through anal inspection. In the woman, he will conduct a careful pelvic exam including vaginal exploration. Among the test's useful tools for the diagnosis of pollakiuria there are above all some laboratory tests such as chemical physical examination of the urine culture, and antibiogram. If these tests are not decisive, the doctor may prescribe further tests such as ultrasound of the excretory tract, CT scan of the abdomen, urography, cystoscopy, prostate biopsy. Once the diagnosis of pollakiuria has been ascertained, the doctor will prescribe an appropriate therapy which will not be unequivocal but will depend on the cause that is at the origin of the pathology. The solutions will therefore be very diversified. For example, in the case of urinary infections, the doctor may prescribe antibiotic therapy while surgery may be necessary in the case of kidney stones. In any case, to treat the problem effectively, it is necessary not to underestimate this disorder and to consult a doctor so that he can trace its causes and suggest the most appropriate solutions. We have now reached the end of today's video. We hope you enjoyed it. If you found it useful, support us with a nice like and subscribe to the channel. See you soon on Med4Care.